Good day everyone, I'm Christine May Hinabe from BSN2 12M, and today I will be performing the LEOPOLD'S maneuver. LEOPOLD'S maneuver is a systematic palpation of the abdomen for assessing the fetal position and presentation. The purpose of the LEOPOLD'S maneuver is to determine the number of fetuses, to identify presentation, position, degree of descent, and attitude of the fetus. Next is to identify the point of maximum intensity of the fetal heart tone in relation to the woman's abdomen. Four-part process, palpation of fetal position and the uterus. Prior to the conduct of the procedure, first ensure that the equipment to be used is complete. This includes the stethoscope, the towel, and the pillow. First things first is wash your hands to deter the spread of microorganisms and to protect my patient and myself as well from infection and cross-contamination. Second, explain the procedure to the patient so that the patient will gain patient's cooperation. Good day, ma'am. I'm your student nurse for today. May I see your wristband? Please state your name.
Very Gonzalez.
How old are you?
25.
Okay, thank you, ma'am. For your information, ma'am, I will be assessing your abdomen so that we will know what is the position of your baby inside. Next, let the patient empty her bladder before the procedure. The distended bladder may slightly deviate the uterus. Ma'am, would you like to void at this time?
I already void.
Okay. Position the patient as supine with one pillow under her head and with knees slightly flexed. To facilitate the accurate assessment and providing comfort, flex knees relieve tension of the abdominal musculature. If right-handed, stands in a woman's right facing the patient to easily grasp the symphysis pubis to be done in the third maneuver. 6. Faces the patient and palpates the uterine fundus to determine what part of the fetus lies in the upper part of the uterus. Head feels hard and round, freely movable and palatable. Bridge feels softer and nodular. I will palpate it. Next, palpates in a downward direction on the side of the abdomen, applying gently but deep pressure to determine the position of the fetal extremities, the fetal back, and the anterior shoulder. If fetal back, a long continuous structure will be felt. If extremities, it will feel nodular, reflecting the portion of fetal extremities. Places one hand over the symphysis pubis and grabs the lower uterine segment between the thumb and fingers to feel the presenting part. The head is on the inlet or in pelvis in zero station. If presenting part is still movable, it is not engaged. Turns and faces the woman's feet to confirm the findings of the third maneuver and determine the flexion of the vertex. Locates again for the back of the fetus and places the stethoscope over it and listens to the fetal heart tone for 1 full minute. Ma'am, your baby is in the normal heart rate, and it beats 120 beats per minute. Next, note the location, rate, and character of the FHT, or makes the patient comfortable, to ease and to promote relaxation. Lastly, document the observation, made the fetal presentation, position, attitude, and whether engaged or floating. That's it for today, and thank you very much.